earlier, every month we have this Prime session, which happens during the first Monday of every month. So it's a community that we gather together to hear from other scholars, what their research, and having networking as well as discussion about the research work. So today we have this first speaker. Let me introduce you the first speaker, Dr. Chung-Hsien. Okay, Dr. Chao is a professor at the emergency department, and he's the director of Clinical Skills and Simulation Center at Chang Memorial Hospital. So Dr. Chao received his PhD training in the field of biostatistician and epidemiology in National Taiwan University, and also holds a master degree in clinical education at Flinders University, Australia. So today he's going to share with us a very interesting area, which is the pathway. So two pathway, one professional, a mixed method study comparing learning experiences of traditional undergrads and post-baccalaureate medical students. So over to you, Dr. Chao, for your presentation.
Hello, everybody. Can you hear me okay?
Yes.
Okay. I'm Dr. Chung-Hsien CHAOU from the Department of Emergency Medicine in Chang Memorial Hospital, Taiwan. Thanks for the opportunity to present in the NUS-PRIME. Today, I will present from our ongoing study titled Two Pathways, One Profession, a mixed method study comparing learning experiences and of undergraduate medical students and post-baccalaureate medical students. So globally, medical educational system vary considerably, reflecting national policies, societal values, and healthcare needs. One major difference lies in medical school entry. Some systems adopt undergraduate entry pathways, while others, like the US, require a prior degree. In Taiwan, and also in Singapore, both pathways exist side by side. The traditional undergraduate medical program is 6 years in Taiwan post-high school, and the post-baccalaureate program is 4 years for students with a prior bachelor's degree. These two groups of students, they both undertake hospital clerkships, or we call observerships during the last 2 years prior to graduation, and followed essentially the same courses after graduation. However, they differ in age, background, and life experiences. This slide compared two pathways according to literature and clinical experience. The undergraduate medical students, they are younger, mostly younger, academically elite, often less clear about their career path, and with limited social experience. However, they tend to have better physical stamina and are more active in extracurricular activities. On the other hand, the post-baccalaureate medical students are older, enter medicine after prior study or work experience, and typically have clearer motivation and career goals. They bring greater maturity and resilience, but may have less physical stamina and face more stress from night shifts. So the existing literature documents structural differences across countries, but cross-country comparisons often face apples versus oranges issues. Empirical data directly comparing the undergraduate medical students and post-baccalaureate medical students within the same system are very limited. Prior studies describe traditions in medical education broadly, but few have systematically examined how learners' age, motivation, and background influence their adaptation to clinical training when both pathways exist. Therefore, our study aimed to compare students' backgrounds, personalities, learning experiences, and career goals, to analyze the strengths of both educational pathways, to provide local, first-hand data to fill research gaps, and to inform policy and curriculum development to create more responsive educational system. Methods. This is a 4-year mixed methods multi-institutional study across 6 medical schools from 2023 to 2027. We followed 81 students from 2 pathways. Starting from the year before clerkship, we collected quantitative data through validated surveys and qualitative data through interviews and audio diaries. Here I present some of the results from the initial 2 years. We carried out this study across 6 medical schools in Taiwan. You can see the distribution on the map, some larger groups in the north, others smaller in central and southern Taiwan. Altogether, there are 81 students, giving us a broad and representative mix of participants. The tools for data collection included the Preparedness for Hospital Practice questionnaire, measuring self-perceived readiness for clinical practice, the Copenhagen Burnout Inventory evaluated burnout, the Perceived Stress Scale assessed perceived stress, and the NEO 5-factor inventory captured personality traits. Additionally, we use periodic audio diaries and semi-structured interviews for qualitative data collection, which often offer deeper insight into how students interpret and coped with clinical challenges. The quantitative results. We enrolled 81 students, 53 from the undergraduate program. We labeled them as UMS, and 28 from the Postbaccalaureate program. We labeled them as PBMS. As expected, Postbaccalaureate students were significantly older and more likely to have prior work experience. There was no significant differences between the groups in perceived preparedness across domains. Students from both pathways felt comparably ready in terms of knowledge and clinical skills. However, the undergraduate medical students reported significantly higher stress than postbaccalaureate medical students during transition to clinical rotation. This finding is consistent with our qualitative data, which we'll present later, that undergraduate medical students frequently described heightened anxiety and uncertainty, particularly during early patient interactions and clinical decision-making. Together, these results suggest that students may feel equally prepared on paper, but experience the transition to clinical practice very differently. The personality inventory results showed that post-baccalaureate medical students had lower neuroticism, indicating greater emotional stability, and higher conscientiousness, suggesting stronger self-discipline and organization. The undergraduate medical students showed the opposite pattern, aligning with their reported struggles during clinical transition. These findings suggest that personality traits, shaped in part by life stage and experience, may influence how students adapt to clinical roles. For qualitative analysis, here you can see the timeline for our qualitative analysis. The orange line shows undergraduate students starting in 2020, and the blue line shows the postbaccalaureate students starting in 2022. In 2023, we looked at differences in motivation and background. By 2024, as they entered clerkship, we focused on ethical challenges and stress they faced. This setup lets us track both groups in parallel, see how their clinical experience changed over time. Overall, 63 audio diaries and 40 interviews are collected so far. From these materials, we generated 188 codes, which we grouped into 9 code groups. They cover areas like why students choose medicine, their learning journey, future career plans, prior experiences, as well as reflections, interpersonal management, and learning strategies. Together, these insights helped us better understand the numbers and added more depth to our findings. From the data of the first year, which generally looked into the backgrounds and motivations to become a doctor, many post-baccalaureate medical students had prepared for years before admission, often with prior research experience. Many described their decision as a major life transformation. Some even called it their second life. During transition, the differences came through clearly in students' own words. The undergraduate medical students experienced anxiety, uncertainty, and self-doubt, such as, "I felt like I was being pushed off a cliff." Our understanding was superficial, unable to help my patients. These quotes reflect their higher stress levels and greater neuroticism. Their transition was emotionally challenging, highlighting a need for structured support. In contrast, post-baccalaureate medical students describe smoother adjustment. Clinical rotations are more relaxed. I have had real-world experience. Or I can adjust much faster. Past work experience really helped. For the adaptation process, post-baccalaureate students showed greater initiative and self-directed learning. For example, one participant described how they actively sought clinical opportunities and framed their own questions, reflecting autonomy and self-regulation. Undergraduate medical students, meanwhile, voiced a stronger need for structure, time to adjust, and internal conflict when practicing skills on real patients. To analyze these experiences, we are currently adopting Mesiro's transformative learning theory. This theory explains how adults transform their perspectives when faced with disorienting experiences, moving through 10 phases of critical reflection. This part of the analysis is still ongoing. To summarize, the traditional undergraduate medical students are academically strong, but face more stress and emotional uncertainty during the clinical transition. On the other hand, post-baccalaureate medical students benefit from life and work experience, leading to greater emotional regulation and self-directed learning. These findings call for differentiated educational strategies. The undergraduate medical students may benefit from structured supports, such as simulation, early clinical exposure, mentorship, while post-baccalaureate medical students may thrive in flexible learning environments that acknowledge their autonomy and prior experience. And let me add something here. This presentation mainly focused on results during their transition to clinical stage. The results from last year, or the first year of the study, actually indicated that undergraduate medical students found their academic workload somewhat easier. typically, undergraduate medical students have also performed better on earlier university entrance exams, since medicine is a highly competitive field and only high-achieving high school students are more likely to gain admission. In addition, we anticipate that once they graduate and face the demanding nature of medical work for young doctors, the younger students in undergraduate program will likely to have more physical stamina to handle clinical duties. And these points were not presented in this report. In conclusion, this is one of the very few studies to systematically compare the two pathways students using both quantitative and qualitative data. In our preliminary data, while both groups are equally capable, their differences in age and experience shape how they adopt. These insights can inform more responsive and equitable medical educational policies. We look forward to analyze follow-up data in the future. Thank you very much.
Thank you, Dr. Chow. This is a very, very interesting studies and very interesting results that you have shared with us as well, comparing the undergrad students and the post-baccalaureate. So can I, while waiting for the questions to come in the chat,
Sure.
can I ask, because you mentioned you analyze 63 audio records and 40 interviews. So can you elaborate a little bit, like the 63 audio records, how do you seek help from the students to do this recording, and what is this audio recording about?
Okay, so we have structured questions for the medical students.
Okay.
For the annual audio recording, we asked them to describe how they learn and how they adopt in the past 2 months. And then after clinical rotation, we asked them to describe their team and their daily routine and one most satisfactory experience in the past 2 months, and one most disappointing or most challenging experience in the last 2 months. That's for the audio diary, and it's the same question every year. For interviews, we have different themes for each year. So the first year is about their background and their motivation. And the second year, this year, is about transition. And the next year is about preparedness for independent clinical practice. So every year has a major theme. For.
Okay.
Yes.
All right. Thank you for elaborating that. So with the results that you have obtained, what measures or initiative are the schools taking to improve the undergraduate medical program to support the students? Because we can see from the results that the undergrad students have high anxiety, stress. Yeah.
So yes, so for post-baccalaureate medical students, most of them have experienced one school to work transition in the past. So this is actually their second time transition. So they are more used to this kind of transition from classroom to workplace. But for undergraduate medical students, it's their first time, and they are not aware of how the workplace is and how it works. So I think we have come up with some suggestions, but it's only put in the discussion because it's not a solid result. It's just that we come up from the literature and from discussion that mentorship and simulation and early clinical exposure, some maybe as early as the first year and second year, and have them to be used to the clinical setting, the work place earlier in the school years. We think that might help.
Okay, okay. So I hear that early clinical exposure actually helps them to adapt better. Mentorship helps as well in this segment, and these are the things that the school has actually put in place for the students, especially the undergraduate medical students.
Mm-hmm.
So there are a few more questions coming up. One of the participants asked about the post-baccalaureate students. Some of them might have past clinical working experience, but some might not have. So, do you see any difference with those who have clinical and non-clinical experience background?
Yeah, we do have many post-baccalaureate medical students. They were pharmacists or they were medical laboratory scientists before. And yeah, we didn't specifically look into this group of students. It's a very good idea. I think we should. Yeah, maybe the past working experience in hospital really helped them in the future medical study.
Then would you be able to share with us, like among your participants for post baccalaureate students, medical students, how many percentage are non-clinical background? Do you roughly have the idea?
We have about 2/3 of the post-baccalaureate medical students, they have working experience. And I think most of these students worked as medical profession allies, like pharmacists and radio therapists.
So did you?
And some
sorry.
some of them graduated from biology background.
Okay. So I would say most of them, 80% of them would have a
Yes.
clinical background.
Yes,
All right.
related to medicine.
Okay. Then another questions would be, do you see any particular areas both undergrads and postgrad students share as challenges or issue leading to stress or problem in adapting to the learning environment?
Yes, so for the transition, I think the most challenging part is how to apply your knowledge into clinical patients. And both groups of students, they have reported these kind of challenges, like applying knowledges.
I see. In applying knowledges, both students share that they have this issue.
Yes.
How about we hear a lot of, I think you share a lot of good things about the post-baccalaureate students, such as they have better self-regulation, better in adapting to the environment. Any limitation or any challenges other than unable to apply knowledge? Any challenges that this group, especially the post-baccalaureate medical students, face in dealing with stress or the learning environment?
So we're still trying to validate our so actually the post-baccalaureate medical students, they are older, and from our experience, they tend to be more exhausted after graduation for the duties, night shifts, etc.
Okay.
And they tend to choose more safer choices for specialty because they are about 6 years older than their counterparts. So they tend to choose more like family medicine, internal medicine. But for physically challenging specialties, they tend to avoid them.
I see, I see. That's a very interesting outcome that it wasn't shared in this presentation. Am I right?
Well, so actually, this is the cohort. They are just in their in their first year of clinical observership. So
I
this
see.
cohort will graduate next year and then become PGY1 next August, and we will follow this cohort until the end of the first year, their graduation.
I see, I see. That's a very good longitudinal tracking plan that you have to see in long term how do they perform.
Yes.
So thank you so much for presenting such a wonderful and I would say very comprehensive research that you have conducted. And I do look forward to see your follow-up research as well on the PGY1 students.
Thank you. Thank you very much.
So